Okay. I think we're on.
Good morning.
Good morning. Good morning. Good morning, Dr. Flowers. Good morning, everybody. My name is Tim Westbrook. I am the host of I Love Being Sober, and just truly honored and grateful to be here with Dr. James Flowers today. I love being sober. I absolutely love it. I love my life today. And I've learned so much as a result of my sobriety, of recovery, and the goal and the purpose of this show is to share messages, educational content with people, and ultimately help some other people get to a place where they love being sober as well. Because I can tell you, before I got clean and sober, I never thought that being sober was going to be a good thing, and I thought my life was over, actually. So James Flowers, Dr. James Flowers, I'm going to read a little bit about you. For more than 29 years, Dr. Flowers has been one of the most familiar and respected names in the area of mental health, chronic pain, and substance use disorders. A leader in the field, his history in evaluations and treatment of chronic pain and co-occurring substance use disorders has led to an exceptionally distinguished career. He has developed and built many of the nation's leading pain and substance use disorder recovery programs within some of the most respected healthcare and addiction treatment centers in the country, successfully guiding teams in evaluation, treatment planning, and course of treatment. With fellowship training in behavioral health management, Dr. Flowers completed clinical rotations at the University of Washington, the Rosomoff Comprehensive Center for Pain, the University of Miami, and the Mayo Clinic. As an entrepreneur and expert in the healthcare field, Dr. Flowers founded J. Flowers Health Institute and has additionally founded renowned upscale treatment programs throughout Texas. Dr. Flowers has dedicated his career to his passion, designing multidisciplinary treatment programs and clinical protocols to help individuals suffering from substance use disorders, mental health issues, and chronic pain. Dr. Flowers is a lifelong distance runner with more than 28 marathons to his credit. He has completed in several ultramarathons, including 70 and 100-mile races. In addition, Dr. Flowers is a pilot.
That was a mouthful. I cannot believe you read that whole thing, Tim.
That was a mouthful, but that was great. And this is awesome. I'm so just really looking forward to getting to know you. I had no clue that you were an ultra marathon runner. I'm a triathlete, and
Nice.
and I just never knew. I've seen you. I've seen your name. I've seen you at lots of conferences.
Yeah.
I know a lot about your programs, but I'm really looking forward to diving in and sharing with everybody else more about your evaluations and the comprehensive diagnostic evaluations we're going to talk about, and their importance for proper placement and treatment, pain recovery, and mental health programs, understanding the human condition, and taking the guesswork out of healthcare, which is
Sure.
makes total sense when you think about it, right?
Absolutely.
So welcome.
I got to say one quick thing on the marathoning, ultra marathoning is one word was left off of that: retired. Nowadays it's about 3 miles at a time.
Okay, there you go. Well,
my last marathon was about 5 years ago, but I don't know if I'll ever run another marathon, but I do love running, and it is absolutely a passion, and it helps my mental health, and it's one of my therapies. So yeah,
right.
I wouldn't put in retired though.
Right. Yeah. Well, I can relate. I've done Ironman a couple of times, and it's just the training, the journey, and I went for a ride this morning, which was just like, it's therapeutic. It's therapeutic. I'll tell you what, I get a lot done when I'm on that ride.
Absolutely. I completely agree. I met with my trainer this morning at 5:30 this morning. I was up at 4:30 and did a little meditation, a little preparing for the day, and then went and worked out. And when I'm working out with my trainer, it is therapy, right?
Yeah.
I'm in my mind and I'm just following and I'm working and I'm doing what he asked me to do. But even though I'm listening to him, I'm also talking to myself up here and really getting ready for my day. So I love those early morning rides and early morning workouts.
Yeah. So tell me, and this is on my ride this morning. What I was thinking about was what the podcast I was listening to was a Lewis Howes podcast, and he talked about the morning routine. And I was thinking, man, maybe I should come up with a standard question that I ask everybody. And maybe my standard question is, tell me about your morning routine.
Yeah. Great. Well, I'll tell you, today's morning routine was a little bit different about what I thought about, at least in my morning workout. And that is how am I going to do on Tim Westbrook's podcast? And don't embarrass yourself, James. And,
right.
It's all about preparing for your podcast. But I really, I woke up at 4:30 this morning. I generally wake up around 4:45, 5 o'clock, prepare for my day. I do a morning meditation. I really meditate about my health. You probably don't know this, but guess what? I live in Houston, Texas, and I had COVID.
Okay, I did not know that.
No, and I had, thank goodness, Tim, I had a really mild case, and I'm so grateful that I had a mild case. I never ran fever. I did have a horrible headache for about 3 or 4 days. And then I lost my sense of taste and smell for about 3 or 4 days. And it is so bizarre not to be able to smell anything or taste anything at all. Wow. I never thought it would be a big difference. But so health and wellness is a big part of my life. And so when I was going through that, it was scary. It was stressful. It was depressing. And I thought, what is this going to turn into pneumonia? What's going to happen? So even more so now, I'm paying more attention to my body. And I was already so careful about COVID. And I'm continuing to work just like you are. And we're being productive. We're just doing it in a different way. And I thought I would be one of the last people to catch or get diagnosed with COVID. And I don't know how I got it to this day. I have no clue. But I did. And so I'm even more cognizant of my mental health. And so my morning meditations really focus for me on health, wellness, productivity, getting through the day, goals for the day, looking at, do I need to finish anything up from yesterday? And then at morning exercise and continuing my inside self-talk, trying to do positive self-talk about the day.
Right.
And then just preparing for work and getting going. So a lot of prayer and meditation.
So the first thing you do is not look at Facebook.
You know what? I try not to. Most mornings I don't. I give myself a while.
Yeah. No, I'm the same. I Facebook is not something that I jump right into. It's kind of like jumping into chaos, right? I mean, to your point, it's like, let's get up, let's do some breath work, let's pray, let's meditate, let's get quiet, let's go for a run, let's go for a ride, let's reflect, let's journal. Let's read something. You know what I mean? It's like, let's get our mind set for the day.
List.
Let's do a gratitude list. Yeah, absolutely. So tell me a little bit. And by the way, so we are live. Anybody out there, give us a let us know you're there. Give us a thumbs up. Give us an emoji. Give us a hello. And anybody who has questions for Dr. Flowers, because we're going to talk about these evaluations, which I know that there are lots of people out there that really want to learn more about these evaluations and how they are instrumental in properly placing people in the right treatment program. So if anybody has questions, post your comment and we're live on Facebook and we're live on YouTube right now. Post your question, say hello. So let's start with tell me a little bit about your journey and how you got to where you are today.
Yeah. Well, I like to say that I got into this industry when I was a child because I was in therapy very early.
Okay.
Tim, I grew up in deep South Texas, down near the Mexico border. Really grew up on a ranch and outside of a very small town in South Texas. And my grandfather was a surgeon and my dad owned car dealerships. And so we were kind of big fish in a little pond. Okay. But let me tell you, very dysfunctional big fish.
Okay. When you say deep South Texas, where, like, what city?
Alice, Texas. Yeah.
Down Dallas. Okay.
No, Alice.
Okay. I was going to say Dallas is pretty well known.
Yeah. Dallas. Little bitty town, Alice, without the D. Yep.
Okay. Okay.
And yeah, it's a small town. You know, on the weekends, when I grew up, we almost every weekend were in Mexico. That's how close we were to the Mexican border.
Okay.
Family had a home in Mexico, and we would go across the border every weekend to a little lake. We had a little lake house in Mexico, and my dad was an alcoholic, a severe alcoholic. My mother was the best 70s Valium addict in the world. My mother loved to disappear with Valium. My dad loved to get mad on scotch and whiskey. And I was 10 years younger than my oldest sister. There were four of us. I was the youngest. And so I had an oldest sister, Brenda, and then I had twin sisters in the middle, and then I was the youngest boy.
Okay.
And so my oldest sister was 10 years older than me. She started smoking pot when she was probably 14, and quickly escalated from pot to other substances, even all the way up to heroin and cocaine and things like that. And in this little town, when someone, you know, like, you know, my family was fairly well known again in this tiny town. And so the police would catch her doing coke, and they would just say, Brenda, stop doing that, and let me take you home. And they'd put her in the car, and they'd bring her out to the house, and they'd look at my dad and say, you got to get her to stop doing this. You know, there's never any consequences. Right. And my dad was like, sure. You want a scotch? And my mom was like, you want a Xanax? And I was raised by a nanny, and that was from Mexico, that lived with my family. And she was really my mother. And her name was Eva. And in fact, she just died this year in her 90s. And she worked for my family for over 50 years. Wow. My mom was 8 months pregnant with my oldest sister, driving down the street, met her, said, I'm looking for someone to help me. I'm about to have a baby. And Eva jumped in the car and lived with us for 50 years.
And that was it.
But I was really raised by, she was the healthiest person in my family. And so my grandfather was a surgeon, and he would get high and on heroin and do surgery. It was a madhouse. It was crazy. And he eventually quit using, thank God, and got into his own recovery. But my dad took my oldest sister to treatment when I was 10 years old, took her to Dallas, Texas, with a D, dropped her off in treatment, turned around, drove home, and walked into the house, and we sat down at our dinner table. My dad was at one end of the table. My mother was at the other end of the table. My sisters were sitting with me, sitting with us at the table. And my dad had just driven 12 hours back, you know, for the full day, had dinner, picked up his scotch, took a drink of it, looked at me, and fell over and died, and had a heart attack and died right in front of us. My mother.
How old were you at this time?
I was 10. Yeah.
Okay.
And my mom was sitting at the other end of the table, and she stood up, and she had her vodka, and she stood up, and she looked over, and she saw my father on the floor, and she drank her entire vodka down and said, I'm not going to tell you exactly what she said, but she said, well, what the hell are we going to do now?
Whoa. Now, now at that time, what did you guys think? Did you guys think that he just passed out, or what did you think happened to him?
You know, I had seen my father pass out growing up, and I thought, oh my God, for a split second, I thought, did he just pass out? Is he drunk already? Because I knew my father drank every day. And Eva, my nanny, comes running in the room, and she says, let me call Dr. Bill, who is my grandfather, the doctor. And she ran to the phone, and I leaned over, got out of the chair, and I checked on my dad, and I knew at that moment that he had died. And my mother didn't know what to do. My mother is just standing there like this, frozen, right? And my sisters are crying, and I'm sitting there, and I take control and just tell my mom, go in the other room. I told my sisters to leave. And they were 5 years older than me. They were 15, 16 at the time. I was 10 years old. And I rolled my father over, didn't know what the heck I was doing. I tried to give him CPR, and he was dead and not coming back. And about an hour and a half later, we were so remote, an ambulance showed up and picked my dad up and took him to the hospital. My grandfather met them at the hospital, and certainly was not able to be revived. So I grew up in a lot of, and my grandparents and my mother, thank goodness, were at least willing and knowledgeable to say he needs some therapy. That was very traumatic for him.
Yeah.
And so I went in to see a therapist when I was 10 years old. And it was one of the best things that ever happened to me. I still remember her. I remember the groups of other kids in my class. Some of the kids in my class would go to group therapy with me, and really kind of helped resolve some of that feeling and that trauma of seeing my father die, but really not only seeing my father die, but also watching my mother's dysfunction. And my sister left treatment, came home for the funeral, did not go back to treatment until about a year later. And she relapsed throughout that year. Yeah. And so from the time I was 10 until I was in college, my mother continued to use Valium and alcohol. My oldest sister, of course, was at that point continually relapsing in and out of recovery, alcoholic drug addict. And then I was in my sophomore year of college, undergraduate, working on a business degree. I thought that I wanted to get a degree in marketing and finance, and I eventually did. But I had no real desire at that moment to go into the treatment field, of course, or mental health. My grandfather wanted me to be a physician, and I said, no, I'm going to be a businessman. And my sophomore year of college, one of the twins was diagnosed with a very aggressive cancer. And my junior year, my oldest sister, who was in and out of recovery and in and out of every treatment program in the country, I think, one morning, my junior year of college, my mother called me and had said, bawling, that my oldest sister had fallen off of an 8-story building balcony of her apartment and landed on the street below and died.
What?
Yeah.
Oh,
so,
gosh.
Yeah. And then exactly a year and a day later, one of the twins died of cancer. And so from the time I was 10 years old until I was a senior in college, getting ready to graduate with my degree, it was an extremely traumatic childhood for me. I had, experienced the death of my father in front of me. I watched my mother as this raging alcoholic, Valium addict. And it's really interesting. Again, I was raised by Eva, who really took care of me as my pseudo mother, my grandmother. My real grandmother was really healthy as she could be as well. And they really nurtured me. And my grandfather got into his own recovery, stopped using. He really nurtured me as well, and really kind of held me together and put me in therapy. And I stayed in therapy as a child for years. And I think without that, I would be dead. I really sat back as a 10 or 12-year-old at that time and looked at my family, and in therapy realized that I am watching this crazy movie and I don't want to be involved in this. I'm going to do whatever it takes to not be involved in this craziness. And so for me, I am a grateful adult child and an AlAnon. And I often talk about, I have no idea why I never became a raging drug addict or alcoholic. I've never smoked pot. I've never smoked a cigarette. I think what happened to me is I just was like completely freaked out and went the opposite way, and really put myself into more of a health and wellness perspective, and knowing that I saw what it did to my family immediately, and that I didn't want to participate in that. And it saved my life. And therapy saved my life.
Yeah. And how did you, what was the motive, or not what was the motive, but how did you end up getting involved with therapy? Because you had your entire family who probably needed therapy, obviously, right? And they didn't move forward with therapy, but you did. How did you find therapy, and why did you stay involved with therapy?
Yeah. I noticed that I remember in the 6th grade, I remember my school counselor. And my 6th grade counselor knew about my family, of course. And my family, by the way, in South Texas is really well known as this wacky, crazy family. And my counselor in school and my mother actually met, and my counselor recommended that I see a therapist, and they put me in therapy. My mother had a psychiatrist. My mother would always see her psychiatrist every week from the time I was born till I was out of college. She was in psychiatry. So my mom was a big fan of psychiatry in the 70s and psychoanalytic psychiatry, and she was psychoanalyzed for years, but it didn't seem to help her until later in life. And my mother did eventually get in recovery, and she died last year at 82. And we were very, very, very close. But my mother was wise enough in her own dysfunction to put me in therapy. And I think that partly because my school counselor recommended it, but also because my mother was seeing her own psychiatrist every week. Yeah. Thank goodness. But, and I had no desire at that point. I was working on my degree in marketing and finance. I graduated with a degree in marketing and finance. And then my sister, who had cancer, was a patient at MD Anderson Cancer Hospital, which is the world's leading cancer hospital here in Houston. And I met her. My sister had horrific chronic pain from chemotherapy, radiation, and she had nerve pain. And I met her pain doctor. His name was C. Stratton Hill III at the time. And for some reason, when my sister died, he came to her funeral, and which is very rare for any physician to go to a patient's funeral, but especially a cancer doctor, especially when they're working with terminal cancer patients. And at her funeral, after her funeral, he came over, shook my hand, said he was so sorry. And he said, "Why don't you come visit me next week?" And I said, "Why?" And he said, I have a few things I want to talk to you about. And so I went to MD Anderson the next week, didn't know what I was doing, had just graduated from college. I was planning on applying for my MBA. And I sat down with Dr. Hill, and his wife was his nurse. And I sat down with the two of them. And he said, "I watched you for years with your family and your family system, and your sister had chronic pain. And I watched you navigate that with your family." And he goes, "Have you ever heard of a program called AlAnon?" And I said, "I've heard of it, yes."
Yeah.
And he said, "I'm in recovery, and I want to invite you to an AlAnon meeting." And he said, "Not only that, but you have a gift, and you have a gift at helping people." And he had gone to the University of Washington in Seattle in medical school. And he invited me. He was doing a lecture at University of Washington, which is the oldest pain program in the United States. It was established in 1952. And he said, "I'm doing a lecture in Washington, and my wife and I are going, and I'm speaking, and I'd love for you to join us." And I thought, why is this man doing this? And why does he have this interest in me? And I said, "Well, I think I'm going to get my MBA, but let me think about it." And I decided to go to Washington with them to Seattle and attend this lecture that he was giving. And Tim, it changed my life. I was going to get my MBA, and I realized at this lecture that, again, watching my family, watching the dysfunction, the addiction, the mental health issues in my family, my own issues of depression, really, and overcoming all of that trauma, that I did have a purpose. And that purpose was really going back to school to get a degree in psychology, and then go on all the way through my PhD, and really give back to patients who are suffering with mental health, substance use disorder, and dysfunction, trauma in their family. And it really is truly my passion in life. But I always say I've been in the industry my whole life. Professionally, I've been in this industry for now 29 years, which drives me. I'm like, wow. But yeah, May was my 29th year.
Wow.
and I just love it. So,
wow. So how did you, and thank you for sharing that. That was so cool to hear your journey and hear kind of how you got where you are today. Let's going back to Al-Anon for a second. How did you, because I know lots of, and I'm sure you have come across lots of family members that are they're just like, they're not willing to look into Al-Anon. They just they're like, I don't think I need it. It's not for me. I'm not the addict. I'm not the one with the problem.
Mm-hmm.
The problem child needs to go get help. I'm good. Why did you, like, what was the benefit to you of getting involved? How did it help you?
Oh my gosh. I think it was part of my own journey to wellness and health. And I felt like, when Dr. Hill introduced, I'd known about it for years because members of my family were in and out of treatment, and I had been invited to Al-Anon. And I was one of those people that said, I'm healthy. I don't need to go to Al-Anon. It's my family, right?
Right.
And then Dr. Hill talked to me about Al-Anon, and I went to my first meeting with Dr. Hill, who became a mentor to me. And I just realized that I don't know it all. And I wasn't as healthy as I thought that I was. And I was a collaborator, and I was an enabler in my own family. And I was as sick as the rest of the family without using drugs and alcohol. Right. And Al-Anon really helped me understand that I need to stay out of their business, right? And quit controlling and quit trying to control and quit taking care of. And I became when I was 10, I became a pseudo husband for my mother. My mother never remarried. And I really, at 11 years old, I was balancing all my mother's checkbooks. I was paying all of our bills. I was, really running my mother's life and helping her navigate the world at 11. And which is just crazy. So Al-Anon really taught me it saved my life, I think, but it also taught me that I'm responsible for me and not anyone else. And when I talk to families about Al-Anon, just like you talk to people about their addiction and the importance of recovery and meetings, they're like, I don't need to go to meetings. I can do this on my own. Right. And families obviously say, well, this is my son. I'm working with a mother right now. Her son is a chronic alcoholic. And she's like, I don't need to go to meetings. I don't need this. And I sit down, and my philosophy on working with people is building an extremely close therapeutic alliance with the family and with the patient. And I just sit and build a relationship with the person. And I disclose, I'm not a huge discloser, but I disclose when it's therapeutically appropriate. And I'll disclose a little bit of my own story and my own life and my own recovery in Al-Anon and how it's going to help them. And generally they'll say, I'm going to give that a try. And for me, it's just education, communication, the importance of being a healthy parent, a healthy wife, a healthy husband, and understanding how to communicate with the person who's newly in recovery. And sometimes telling them that it helps you communicate in a healthier way and understand what your son is going through. They almost start going sometimes because they think they're doing it to help their son. And then all of a sudden they're like, oh, wait a minute, this is for me.
Oh, wait, this is for me. Right. I think you have a really good perspective, or you have an advantage because you weren't an alcoholic or a drug addict. So you can talk with a family member and you can share a little bit of your story, to your point, that's therapeutically appropriate, and get them to see the value and get them motivated to at least give it a shot.
Yeah, absolutely. And that's what I do, is I really go at it from that perspective of, let's get out of the dysfunction into function. And let me tell you what dysfunction looks like in your family. Let's talk about it.
Yeah.
And then let me compare it to a couple of issues that I've had in my own life and what it did for my life and how I got to sitting in this seat where I am today. And generally families will listen over time and agree to go to that, to go to Al-Anon, which I think is so important.
Right. Awesome.
Yeah.
Okay, so let's talk about how you got to comprehensive diagnostic evaluations. Now, is that something that you created, or is that something that was already around?
Well, they've been around, of course. I think what I've done is taken it to a different level.
Okay.
And, this is my 29th year, and I've been a program builder for programs across the country for many, many, many years. I built pain programs at Sierra Tucson and helped consult and build pain program at Betty Ford and, Vanderbilt Medical School and other wonderful, incredible treatment centers around the country. And I love building clinical programs, and I love placing people in the proper program. And certainly there's assessment programs everywhere. Not everywhere, but a lot of treatment programs have assessment programs. What I really did is I went back to my roots at University of Washington and my fellowship, where the philosophy is that when we evaluate someone, we really want to evaluate someone in a 360-degree way. And that means what I call biopsychosocial approach, which is medical, right? Psychological, socially, and then every other way in our life. We want to look at spirituality. We want to look at trauma. We want to look at addiction. We really want to look at I call it a behavioral or living MRI of a person. Right. And I want to create this framework, much like when you go into a hospital and you go to an emergency room, and they take an x-ray of your leg, and the doctor comes in and holds the x-ray up and he goes, see this fracture right here? This is what we need to repair. What we do is at the end of this comprehensive evaluation is really truly show them a living MRI of who they are, how they think, how they process, how they problem solve. We look at the etiology of whatever organically is going on, meaning medically or mental health wise. And we give that person a true, clear set of proper diagnoses. And then once the family, the referent, and the patient understand what the true diagnosis is, then we help create a roadmap for future health, meaning let's talk about this treatment center, and this treatment center, and see how it will benefit you and how you will fit in emotionally, spiritually, psychologically with different treatment centers. But there's a lot of assessment programs, but I think what we do is we take it much, much, much deeper. And we really don't look just at psychiatry and psychology and addiction, but we look at that with medical, and then we look at it with nutrition, with physical therapy, with spirituality, and many other parts of our life. And then whatever specialist we need to bring in. Houston, Texas is home to the largest medical center in the world. And we have the top physicians and scientists right here in Houston. And the Texas Medical Center was built on a philosophy of collaboration and communication with each other. So when we need a specialist like a neurosurgeon, an ophthalmologist, or a whatever specialist it is that we need, then we can have that specialist brought in and collaborate with us almost a day or two away. So it's really wonderful being able to do this evaluation here in Houston, because it affords us the ability to be very close and collaborative with the Texas Medical Center and build this rich diagnostic report that, when generated, is about 112 pages long. And then the last 3 pages are a summary with all the diagnoses and then treatment recommendations. And it really does help create this beautiful roadmap of what to do going forward to thrive in life.
Wow, that's amazing. That sounds like an amazing tool, because typically people they're gonna start calling treatment centers. They're gonna figure out who accepts their insurance, and that's basically and it's kind of like throwing a dart.
It is, Tim, and you know it as well as I do. We've both been in this business for a long time. You have a passion for it. You understand what I'm saying. When someone calls an 800 number and gets a call center, they're going to do everything they can do to put that person in their treatment center. right?
Right.
And even though they may not have a trauma therapist on site or true trauma therapist, not just a trauma-informed therapist,
Right.
but someone that really is trained and experienced in treating trauma, addiction, mental health and substance use disorder are hand in hand. And I really want to make sure that the treatment center that the families with whom we're working are properly placed into a treatment center that are able to really work with all parts of that person. So otherwise, they're going to go to treatment. They have 28 days to get through treatment, 30 days, and their insurance runs out. And they go home, and they typically do well for a little while, but eventually the wheels fall off. And not always, but many times. And what this evaluation does is it really, truly helps say, here's the good, the bad, the ugly of everything, and let us help you with wherever it is in the world that the best place for you is.
Right.
Yeah.
It sounds almost like going on Tinder or Match and just like picking somebody, right?
Exactly.
It's like, how do you know it's the right treatment center?
Exactly.
That treatment centers, and I've seen that happen so many times where people end up in a treatment center and they're like, I don't know if this is the right place for me.
Right. I don't know if this is the right place for my son, for my wife, for my, you and I have seen that for years. And sometimes people leave AMA. It's the worst possible thing.
Yeah.
And we want them to be in the right place. And that's the whole goal, is putting the person in the right setting and making sure that it's appropriate setting for them. Yeah.
Right. Okay. So understanding the human condition.
Yeah. Gosh, what is the human condition? I think the human condition is, even what you and I are doing right now, is understanding that all of us have a history and all of us have a condition. Some of us are healthier than others. Some of us are, some of us suffer from major depressive disorder. Some of us suffer from substance use disorder. Some of us suffer from anxiety. Some of us thrive in life. And I like to look at, and some of us thrive with all of those conditions, right? That's the goal, is no matter what your condition is, we want to thrive in life. But some people need help thriving because they don't know how to thrive. And what we want to do is really understand. When I say understanding the human condition, is again going back to that MRI and really understanding who we are, how we think, how we respond, how do we navigate the day? How do we navigate our life? And how do we get through today? Because all of us have so many conditions, right, in our lives that affect our daily responses. And so I like to look at and talk to people about all types of human condition, the good, the bad, the ugly again. Yeah. So,
okay, so let's talk about the J. Flowers Institute and how the J. Flowers Institute came to be.
You bet. Yeah. So I had built an amazing program with a team of people over in Austin several years ago, and decided that I wanted to come back to Houston. Came back to Houston. I have 2 treatment centers in Houston, Kema Palms Recovery and Cypress Lakes Lodge. And I sat back and I, over my 29 years of experience, I see people go into treatment like we were just talking about, and it may be the wrong treatment center. Even my treatment center, right, while it's a wonderful treatment center, isn't right for everybody.
Right. And
sometimes in morning staffings, I'll say, wait a minute, we may not be the best place for this admission.
Right.
Let's think about so-and-so, and let's just not take a patient because it's a patient, right? Or a client because it's a client. Let's place this person in the right place. And I have seen people, just like we said, go into the wrong program. And it just hit me. I said, oh my God, I'm going to go back to my roots and develop this deep dive evaluation that helps families and helps people understand their own human condition, what their proper diagnosis is, and see where they're most appropriate. I don't want to put people in my treatment center or any treatment center if they're not in the right center. I want them to be in the right place. And I see people so often. Last year, I had 14 patients. I hesitate to say this, and I'll qualify it. I love Mayo. Mayo Clinic is an amazing assessment program in Rochester, Minnesota. I did a clinical rotation there. It's the best, one of the best pain programs in the world. But sometimes when we go to a place and we do an evaluation or an assessment, it's limited in nature. And it's such a big system that they'll do an assessment or 10 assessments and they're faxed into a central line. And then all of a sudden at the end of the assessment, you're given a pile of assessments and you're sent to read them on your own and look at your own diagnoses. Right. And I said, I want to build a program of collaboration, and I want people to sit around the table, and I want us to talk about this person and understand this person, work with the referent, work with the family, work with the patient, and place them in the right place together as a collaborative team. So that's how J. Flowers Health Institute was born, is really out of a need in my own mind to not mistreat people and make sure that they're in the right place and in the right program.
Right.
Yeah.
Right. And that makes sense, because otherwise you're really the admissions person on the phone is the one that's making the recommendation.
Absolutely.
They are doing the evaluation by a phone call.
Yep.
Right. A phone conversation. Yep. And that's how they're, and of course they're going to say, well, my treatment center is the right. Yeah, we can help you.
Of course.
We're the right place.
Yep. And what level of care is appropriate. Oftentimes it's amazing how many admissions people say you need residential, right? And they may need PHP or IOP. I don't know.
Yeah.
But we really want to do is understand that person. And again, and what something I want to make really clear is probably less than 1% of the patients that I evaluate go to my own treatment center. I built this not to put people in my treatment center, but to put people in the right treatment center that's appropriate for them and at the right level of care as well.
Right. Okay. That's really good to know.
Yeah.
For a lot of people out there, that less than 1% of the people that you see that you perform these diagnostic evaluations on end up at your treatment center. For the most part, what you're doing is you're creating a roadmap. And then, okay, so once you do this, once you create this living MRI and you create this roadmap and somebody ends up at a treatment center, is there follow-up? Is there continued conversation? Because as you and I know, the roadmap could possibly change.
Absolutely. Yeah. Right. Always does. Yeah. And yes. So we always talk about 3 at least. Sometimes I'll narrow it to 2, but most of the time we'll talk about 3 different choices of treatment centers that are appropriate. Now, occasionally I'll say there's 1, and I'm giving you this 1 because I know they're the only ones that can help you. But most of the time we'll go over about 3 different treatment centers and we'll talk about that. But we not only talk about it with the patient, we call the treatment center. I talk to the clinical team. We talk to admissions. We help the family talk to admissions. We help the patient talk to admissions and the clinical team or whomever I think they need to talk to. And then we send our report with the patient's permission ahead. And then we go over the report with that treatment center. And Tim, what that does, I really, truly believe that by doing a comprehensive diagnostic evaluation ahead of time, it literally gives the treatment center a 3 to 4 week jumpstart. Because in typical treatment, it takes 3 to 4 weeks to really understand the patient with whom you're working. And then they're leaving and going home. Right? Or going back to work oftentimes. Right. So when they have this in front of them and a phone call with my team, they can walk in and start treating that proper diagnosis on day 1. And it cuts out so much unknown, so many unknown issues are presented in a great light to that treatment center. And when I say great light, I mean bright enough for them to understand exactly who they're working with. And it really, again, gives them this hurdle jumps over this hurdle so that they can begin proper treatment day one.
Right. Awesome.
Yeah.
And how long do you stay connected or involved with the patient after they leave and after they go to treatment? Like, how long is your,
Yep.
how long do you stay connected and provide?
It's interesting. It's on an individualized basis. And by the way, at J. Flowers Health Institute, I've never charged a family we have families that have been here a year and a half ago that I still communicate with, that I'm still giving guidance to. And I never charge them for the phone call. I never charge them for advice or opinions or my thoughts and feedback and guidance. Once they pay that fee, I call it kind of a lifetime membership. Then call us anytime you need something. And so we stay in touch as long as the family wants us to and allows us to, which on many of our families, we're still in touch from a year and a half ago.
Okay. That's really good to know. Okay.
Yeah.
So ongoing support. So you're there. It's not once they're gone, they're gone. It's you do the evaluation and you're there to provide support and accountability and direction as long as people need it.
Yep, you bet. Absolutely. Yeah.
How can people reach you? How can people find out more about the J. Flowers Institute if they'd like to?
You bet. So our website is jflowershealth.com. There's a great amount of information on the website, jflowershealth.com. And our phone number is area code 713-783-6655. Woo, I did that. I always forget my phone number. Yeah, 713-783-6655. And it's jflowershealth.com. Yeah.
Awesome. Thanks so much for your time today. I really appreciate you. I enjoyed getting to know you. I enjoyed learning more about you and more about the evaluations that you guys provide.
You're amazing. And thank you for what you're doing. And I can't wait till we get back to conferences and I see you in person. Yeah.
Like